Hello, everyone. Welcome to Digital Front Door Day. Welcome back to those who already joined our sessions this morning. My name is Yoni. I'm the Regional Vice President here at Hyro, and I'll be your moderator for today's session. I'm super excited for this conversation. Near and dear to my heart, Payviders, payers. I'm one of the team members here at Hyro supporting our existing customers on that side of things and our partnerships that we're building out. If you have any questions or comments, please do drop them into the chat. We'll try to get to them as we go here. If not, we'll try to hold a few minutes at the end to get to them as well. But without further ado, I'm super excited for the panel that we have put together today, including Hyro's very own VP product and our friends and partners over at Salesforce. I'm going to let them introduce themselves. Kyle, why don't we start with you, and then we'll have Kevin and over to Uri.
Yeah. Hey, everyone. Pleasure to be here. Kyle May, based out of the Boston area. I'm an industry advisor at Salesforce, covering the payer and payvider segments of kind of our enterprise and commercial books of business. So really excited here to be talking about AI and how we're moving the needle forward for the payers and payviders, and talking about use cases, as well as what are all those other considerations we need to be talking about in order to kind of go from 0 to 1 and beyond. But I'll pass it over to my colleague Kevin for his intro so we can get dug in here.
Yeah, thanks, Kyle. So similar to Kyle, industry advisor here covering payer, payvider. I also dabble in the PBM and retail health space as well here at Salesforce. So I've been here about 2 years. I come from a background of working in payers, consulting for CMS, and also I'm a pharmacist by training. So I look forward to working together with Hyro and discussing some of the really cool opportunities that we have in AI. I'll pass it over to Uri.
Thanks, Kevin. Hi, everyone. Uri Pintov. I'm the VP product. I lead the product and design teams here at Hyro. Very happy to be with you today to talk about this important subject. And thank you, Kevin and Kyle, for joining us on this important subject and journey. Yoni, back to you.
So as we start with every session on the summit, in 2 to 3 words, how do you define the digital front door? Kevin, do you want to start us off?
Oh man, I have to go first on this one. That's a tough question, but I think I look at it as I'd say value accelerator. I'll use my 2 words. Just really a way to bring value to your members, your patients, your workforce, right? It really is a way to accelerate value all across the entire ecosystem.
Love it. Kyle?
Oh man, we're gonna wear an operator hat here and call it kind of an operations conduit, right? So like, how am I seeing kind of the health of everything in one spot, so I know where to kind of dive into, which area the business really needs to kind of min-max and ultimately looking for ways to enhance efficiency, but also think about not just like efficiency and like time saved globally, and not necessarily making additional budget requests to expand a team, but how am I viewing my own team members and employees' time? What is really bogging them down, and how is their experience ultimately being shifted by kind of the perspective that I'm able to bear? So it kind of dabbles between kind of a higher altitude, but then getting into the trenches with the team as well.
I think that's a little more than 2 to 3 words, but I love it.
Ops conduit, and then I explained it, right?
I love it.
I love that. And okay, so I'll try to use 3 words: making users believers. And what that means is, I think there's tons of frustration in access, and I think that making users believers for me means, patients don't know where to go. What do I need to bring? It's so hard to connect to the right place. Also for members and even providers that call in on behalf of members. And I think we're starting to see those moments of delight where you figure out, hey, something here can help me get this job done. And I don't need to wait on the line for 40 minutes. And for me, that's what the digital front door is all about, is kind of improving that experience and that aha moment that, for so many years, I haven't been able to get that. And now I can do it. And then you're a fan, and then you become a fan.
Making users believers. I'm definitely going to steal that, Uri. So let's jump into it. Could you guys walk us through what are the biggest challenges that you're seeing Payviders are facing today, and where do you think AI can help? Who wants to start us off?
I think it's a loaded question, right? I think with AI and being able to look at operational efficiencies, I think a lot of organizations have been tasked with AI. How do we use it? How do we figure it out? Everyone's talking about it, and really just kind of like anchoring that conversation into how does it play into like a global governance strategy around data, right? What is your data management strategy? Because everyone knows bad data in, bad data outcomes out. And I think like really anchoring in those foundational questions first are the most beneficial. I think a lot of folks are wanting to jump into use cases and get into, kind of different parameters around how do we engage with providers, how are we engaging with patients, but are jumping to those areas is kind of like a 0 to 25 as opposed to 0 to 1. And how do we think big about this from a governance perspective? How do we solicit internal stakeholder feedback to really think, about innovative ways and realistic ways to think about the global strategy before jumping into kind of that ops parameter, type of question. And or rather rush to answers around the ops side, right? So I'm almost anchoring this into like, what is the governance use case? What is our data strategy? How do we build a good data strategy on that foundation so we can build floor by floor over the top to make sure that we have innovative and kind of novel ways to approach historically challenging problems across that payvider and payer kind of, let's call it patient, provider, and internal team kind of triangulation.
Yeah, Kyle, I'll echo that. I think if I think about one of the biggest challenges I see when I talk with Payviders, it's around managing the firewalls between those two organizations. They've been historically very split and very siloed, but especially in a lot of our Payvider organizations have the same name, and to your members or your patients, whatever you choose to call them, they don't experience it as two separate organizations. And I see so many Payviders out there, thinking about an example of utilization management, that their providers are sending faxes to the payer side in order to get utilization management approved. And when you think about it, if you look at it from the member perspective, they're sending faxes to themselves. And that's just an example of how the firewalls, while built with the best intentions of governance, right, you really need to think strategically on how you actually drive synergies across the entire organization. Because one of the reasons I love Payviders is because they have such a great advantage, right, of having kind of the payer and the provider side nested together, working together. And technology needs to be a conduit, right, to helping those two sides work together and actually give that great customer experience, that they have all the data. The data is there. It's just finding ways to connect it and make it work across the two organizations.
I love that. And just maybe to add, so sending faxes to themselves. If you look at some of our data and some of the conversations, this is 2024. Yeah, you won't believe how many times we see just requests for what is the fax number to send, which is ridiculous, especially if there's a backend. So I'll go back to the data point that Kyle raised. Especially if there is some way on the back end to consolidate the data and make sure that the data is good enough. Because I think for me, some of the complexities have to do with integration and the quality of the data. And I think AI, the opportunity to bringing in AI here is if you trust the data that you're answering from, and this could be a document or this could be a record in a system, AI could do wonders with that and just automate some of the lower hanging fruit, which doesn't need investigation, just simple things like getting the claim status and things like that. Super easy to automate today if the data is good enough. So 100% agree with that.
Yeah, hard to believe in 2024 faxes are still being used. Kevin, I love that you called that out also, just because it is so common with Payviders having the same name on both sides of the house, but not having the same experience. And it's something that seems so intuitive. It should be that way. And it's so often not, because of what all of you kind of already touched on, a lot of the governance and data issues and firewalls around that. So love all those points. Next question, what are the benefits of having a conversational AI solution on chat, on voice, on SMS, on whichever channel? What are the benefits of having it plugged into a healthcare org's back end, whether that's plugging into their CRM, if they're using a Salesforce, to Facets maybe for claims management, or any other solution they're using within their tech stack? What's the benefits of having Con AI plugged into that?
I can jump in here. I think just from a like a healthcare provider view and from a patient view, I love having the ability to take away some of the transactional tasks that the humans in our organizations have to do on a day-to-day basis, right? So my whole view of where AI can help in healthcare, and whether it's payer, provider, payvider, wherever, is to move from transactional relationships with our members, our patients, our providers, to actually relational experiences with them, right? To building a relationship with them. And so when we can take some of the really mundane transactional tasks and leverage an AI tool to solve those questions and solve them really, really quickly without someone having to wait for a human to talk to, right? It gives our humans in the company time to build those relationships and handle some of the really big and challenging problems that our members or our patients have. So it's really taking away a lot of that time that we spend, printing new cards and finding the fax number for a doctor, and letting us spend time handling health challenges and really making a difference in members' lives. So that's really, I think, from a higher level view, that's where I feel that's a huge advantage.
And I think to add to that too, it's just like the swivel chairing, right? Swivel chairing on all aspects of that kind of patient, member, provider, and then internal organization like Payvider, payer organization. There's a lot of back and forth, right? There's a lot of swivel chairing from system to system, et cetera. And I think being able to have providers get time donated back to actual patient care, not administrative tasks, is massive. But I also think internally within Payvider organizations and payers, how many times are you requesting information from adjacent teams via email, via text, et cetera? Wouldn't it be better just to have kind of a self-service conduit where you're able to get that information asked and answered, returned almost autonomously, right? You need this information to either help a patient or to respond to like a provider, kind of challenge or issue. And I think like being able to leverage AI internally within an organization as much as you are able to leverage it through a traditional kind of customer experience mechanism or provider experience mechanism is massive. And I think that's almost kind of like the unsung area of the business where we aren't looking deeply enough into like how are we making the internal organization more effective, as well as how that organization interacts and interfaces with external parties as well.
Maybe one other comment here. I think one of the most amazing things about conversational AI as it's getting better is the interaction is more conversational. People in chat, it's happening big time. And I think, the ChatGPT revolution in the world is definitely contributing to that. But even in voice, if you listen to the conversations, people are starting to say a sentence or two, and you get to understand the real call driver and not just somebody saying agent or somebody saying appointment. You get a full sentence because people start to understand that they can engage. And two things happen. One, some of the, what Kevin alluded to, some of the more basic things that we can automate, the easy things that we can automate, we can resolve completely. And, think of conversational AI tools as kind of the first line of defense. We resolve jobs, we get jobs done for repetitive things. But even if we don't, and we need to transfer, we are able to capture the context of the conversation much better today than we used to in the past. And I think one of the amazing things, with our relationship to Salesforce, for example, and is the ability to pass that context, both in real time to the agent that is going to continue the conversation, and you just saved 30 seconds or a minute by identifying the member. But even not in real time, even things that you can automate, the Salesforce platform is so powerful in automation and kind of automating flows based on things that happen. We found amazing synergies with our customers, kind of recording what happened in the AI conversation and sending that off to Salesforce. And then our customers, the admins are free to automate a lot of things, including open cases and add to existing cases, and trigger emails and trigger alerts and report on them and find, who needs you the most and call them back. And even if we're engaging with multiple systems in the back end, and even scheduling an appointment with the EHR, if you bring that to life in the CRM, and somebody hasn't been able to schedule the appointment or something bad happened, you can very quickly respond, and that is a big has huge impact on the experience of the member and the provider and the patient.
That's actually one point that I want to double click into too. Like in a past life, I was a payer, and we'd be getting tons of inbound calls from members, right? And we would spend a lot of time trying to figure out what triggered it. Was it something systemic that happened internally? Was it, a random, kind of feed dying or et cetera? So we're trying to triage and kind of figure out what is going on, where the patterns are. And I think being able to see conversational AI, to your point, bring the context over, get all of the voice transcribed so you can actually start running real-time reports and analytics to start queuing up and aggregating. I don't have to wait for this to be 50,000 members affected. I can start to see an immediate trend of 500 members calling in within, let's say, a 15, 25-minute window, and then start to think about what do we do and start investigating it earlier so you can limit that impact. So I think like that is like a huge value added benefit. There is no transfer or manual transfer from like a L1 to an L2 CSR anymore. Like conversational AI is able to deliver that almost autonomously, really, to those kind of reports and kind of real live humans to kind of handle the higher thinking tasks. And I think that's the really big value proposition for organizations, and trying to figure out how AI can be really brought down to bear within kind of a contact center, et cetera. But what does it look like globally with that reporting? And I think like that's a massive tool to kind of have that radar exist to get ahead of these problems before they start to escalate.
100%.
Yeah, and to add to that, right? I mean, even there's so much value to the business, but even just thinking about customer satisfaction on not having to dial a number, go through a number tree on some of the old IVR type call, call chains that you have to go through when calling into a payer, provider, pharmacy, whatever you do. I think being able to give them a conversational experience, regardless of what the ultimate source is and whether it gets transferred to a human after, it really has a more personal feel to it, and really I think is going to have a huge impact on member satisfaction moving forward and solving their problems and getting to it quickly.
Yeah, I love it. I think you all hit on this one point. If I can distill it all down to this one point of improving the end user experience and giving time back to them, I think you all at some point touched on that. And I think that's really important because we can often get so deep in the weeds on the technology, on what we're doing, with these health systems. But at the end of the day, it's about the patient, it's about the member, about, whoever, fill in the blank, who the end user is. So I love that you all touched on that, whether, we're improving the conversation itself or improving the swivel chair experience, or Kevin, you mentioned, moving to that relational type of transaction. So I love that you guys all touched on that, because I think it's easy easy even for me to forget in the conversations that I'm having. If we get down to brass tacks, can you share an example of a successful responsible AI implementation with a Payvider? Who wants to start?
I can go ahead and share one. I think it's been interesting watching the evolution of the different AI solutions, and as payers, Payviders have been adopting them. As the technology has evolved, I've noticed that Payviders, even providers, all of the folks in this healthcare space have kind of leaned towards, hey, let's get some quick wins and leveraging things that can get us a quick ROI and is low risk, right? So if we think about ROI versus the risk spectrum, right? Like how can we get some quick wins? And Uri talked about it a little bit, but just having those conversation summaries and leveraging that to populate some of that data within the CRM to manage call wrap-up. So if you can go from a 5-minute post-call wrap-up for a CSR to 2-minute, that's real tangible ROI that it is super easy to quantify. It makes sense. You take that up to the CFO and they'll sign that paper all day. So I think those are again, not necessarily the sexiest use cases right off the bat, but we've really seen a lot of wins and a lot of payviders working towards that, using some of these different technologies to bring in the call transcripts and start to mine that for data. And now, once they've got those set, they're starting to look at other different things they can do with that data, having that quick win to get the technology in the door.
Yeah, just to echo Kevin's point, anything with like, kind of cases that need to be tracked and managed, you need to rapidly bring a human up to speed. That kind of sits within a contact center, a call center, that sits within a provider relations team. Like, for example, how am I reaching out to providers who have higher than usual, complaints or administrative requests into a payer organization? Is that by our own design, or is that, kind of on the provider side? And so being able to kind of give a more seamless integration in terms of using AI to bring those individuals up to speed and be able to deploy like a real time, faster resolution time to those, kind of providers, or in Kevin's case, the call center with bringing that agent up to speed super quickly, is a massive benefit, or at least as like what I consider like an L1 progression. If we're looking at this through the lens of, like multiple layers of AI, and this is an onion, that's like the first kind of level 1 outer layer of that onion. And as you start to work in through those use cases, you're able to identify other areas of the business that are really impactful. You have higher risk areas of the business like claims and utilization management that you don't necessarily want a heavy hand of AI, but maybe that AI is able to augment some of that time that it takes to bring up like a utilization management nurse up to speed within a UM department around a case, or recommend, which medical policy is associated to that particular, instance or event. And I think like being an augmentation layer right now, not a decision layer, not making a determination or a judgment, but being an augmentation layer to operations, is where we're at right now in terms of having payers and payviders kind of go beyond dipping a toe in the water, but actively pursuing use cases to make their internal teams more efficient, but not replace. And I think that's a really big kind of takeaway here, is like, this is more of an augmentation play of making your internal team more efficient, more effective, so you can get a better outcome for patients, providers, members, et cetera.
That's a great way to
100%.
frame it
Yeah.
up. Yeah.
Yeah, I'll just add, I think, AIs that make agents and medical staff stronger in engagements is huge, and probably a great way to start. Where we've seen success is a lot around the word trust. I think, providers, payers, there's kind of a hesitancy to go with external facing AI without human supervision. And I think the way to go about that is to start with the use cases that create trust and allow you to see that generative AI is an amazing thing, but you have to prove that when you are applying it to even administrative use cases, even non-clinical use cases, where the error is low risk. If there's an error, low risk, even in those use cases, you need to kind of build the trust that the AI knows to answer from the approved source. And it goes back to the data comment on using data that you trust, whether that data is in your CRM or the data is elsewhere on your website. You have to gain trust in the AI's ability to answer from an approved source, and you need to be able to track the chain of thought over and over and over until you're sure. And that is hard to do. And you need a very strong control layer to make sure that, for specific subjects, you don't want to generate anything, especially in emergencies, anything that has to do with compliance. There's just no need to generate anything. There's the same response that you need to provide 100% of the time. And also not recommending things like, medicine and drugs, and like letting our customers being able to turn on and off what topics, subjects are allowed and what are totally off limits really is one of the keys to building trust. And definitely we see some success there.
Hey, Rory, can I just tag on that just really quickly? I think an important piece of what you talked about, and what often is a challenge in healthcare organizations, is that measuring that risk it takes both the business side of the house and the IT side of the house working together on that, because
Yeah.
there's significant IT risk, but there's also business and clinical risks. And I think that's one of the areas that makes us a little slower to act on some of these, because it really takes both teams working together to identify risks and assess them.
I love that comment, and it's so true. And then maybe that's a huge, recommendation starting on off a project. If you don't have those two key decision makers in the same room, you're asking for trouble. You definitely need alignment there at the get-go of the project for sure.
I love that you guys are already rolling into the next place I wanted to take the conversation. I do want to get into use cases specifically, but you've already all touched on risk. And I know it's, we got it without getting down to specific use cases. It's difficult to talk about risk, but I guess maybe from a high level, pretend, you're a CIO, you're ready to deploy responsible conversational AI. What would be a good starting place in terms of how are you measuring risk? Are you using existing governance policies that are already in place? Are you bringing in new ones? I guess the question would be, how are you measuring risk, or what's that starting place for understanding how to measure risk for these initial use cases you'll roll out?
It's the defining question, I think. And I kind of alluded to that a little bit with like that data governance strategy. Well, risk plays into that too, right? And I think like as this hypothetical CIO, like I would need to like use existing risk management like parameters, but this is like a nascent technology. So you need to be thinking about it in almost a different way from a different angle, but using the same fundamental kind of controls and ideologies that have like propped up your organization doing the right thing. I think it really just underlines that aspect too, which is what is doing the right thing with AI beyond ethics, beyond kind of patient engagement. I think you're kind of hinting at this in your last comment, which is on that trust layer. And that's something that Salesforce like actually like believes through and through, is like getting that trust layer right for customers is playing into this kind of governance risk management strategy, which is effectively, how do you start to categorize this? Maybe we go about through the lens of what are the HIPAA tasks versus non-HIPAA and administrative tasks, right? There's another layer to this too that I kind of mentioned beforehand, which is what are those adjacent areas that will be kind of, you'll be making a determination or a recommendation on, either through a clinical aspect or through a direct kind of care delivery mechanism. And I think like those areas with HIPAA making a determination are super high risk, because there are a lot of adverse reactions or outcomes that could occur with providing improper information or AI hallucinations, for example, where you think it's the right output, but really it's the AI hallucinating and sending something that isn't valid across the line. And I think really trying to group it up, at least in this like first wave, would be like, what are the admin tasks that are bogging down my external stakeholders and internal stakeholders, and how do I make their lives more efficient? And then, through the trust layer, through those use cases, expanding the footprint incrementally into moderate risk areas when you have a really good understanding of how you're deploying AI internally. You can't rush to the highest risk, highest reward areas. You need to make sure that you're taking a very conservative yet pragmatic view on how to get there. So I think it's kind of a recalibration of existing risk management profiles and then deploying net new to kind of overlay and kind of move that AI conversation forward internally. But it's also bringing the right stakeholders into the conversation. Don't compartmentalize. So
I'll add something really I think interesting that we learned over the past couple of years, which is AI can do a lot of things, and I think where you should definitely use it more and more is the whole part of understanding what the person said, what the user said, understanding and really even sometimes rephrasing, but rephrasing based on data that you trust, and not necessarily generating something new. But even in rephrasing, there's some risk. And we've taken a lot of effort to, every time we rephrase and of course, every time we generate anything with AI, there's kind of a supervisor that is evaluating the answer before it's sending it to the user. And there are a lot of control layers in there to make sure that if the subject is risky, you want to fall back to a safe answer. And the way we measure it is probably the hardest, is basically measuring great answers, but also measuring bad answers. And kind of there's a very, very kind of a lot of work needs to go into classifying those before you're sure. And if there's a slight risk or uncertainty, you need to be able to fall back to a safe answer. And that's the way to start, I would say. Yeah.
Kevin,
Yeah,
anything to
I don't
add
have
there?
much to offer. I think Kyle and Uri cover that really, really well. Kyle said a couple of things that I'll just echo is get the right people in the room. I think Uri said that earlier. Get everyone in together. I've seen a lot of really cool, a lot of payers have been standing up kind of AI governance committees, right? Where you bring everybody into the room and you have IT assess the risks, business assess the risks, right? And you start to pick off kind of those high ROI, low risk use cases, right? And that's kind of where we've gotten to some of these kind of call summarization, right? Areas where you can get hit a couple singles before you go for the home run.
So if you think about those use cases and a few singles, so maybe categorize them as we call them skills, jobs to be done that are kind of non-personal. So you're answering a question about a health plan without knowing that I'm speaking to Kevin. So I know the health plan, the subtype, and I can answer questions about deductibles and what happens if I get this service or that medication. And I can kind of ground the AI to speak from the specific source. And that's definitely something that we're doing. It gets more interesting when the skill becomes personal. And after I have been able to identify who you are. And then I think that the next level up is after I've identified the user and going into the right backend system, then the second level is kind of just giving you back information without making a judgment or a decision. I think Kyle alluded to that. And claim status is a great example. And also, explaining a little bit, explaining what's going on. Why do I need to pay what I'm supposed to pay? Explanation of benefits and questions around eligibility. I think those are super important for members and for providers calling on behalf of members. And I think that's also a great place to start. I think the third level, which is probably the hardest, is kind of starting to do investigations and things that you kind of need to apply multiple systems, things that really human beings are very good at. And I think at this stage, definitely the first stage, you should augment, the person that is doing that investigation and help them be faster and more efficient with AI. And probably wait a little bit until the AI is good enough that you trust it 100% of the time to give the right answer, because there could be repercussions if you and even agents in the call center, they make mistakes as well. But I think the difference here is trust. You need to trust this thing 100% before you let it provide those answers.
So we only have 7 minutes left, and I wanted to definitely get to use cases and one more future crystal ball question. So if maybe each of you can talk about, we've already touched on high risk use cases, low risk use cases. Obviously, if we're going after the low risk, if I'm a CIO ready to deploy the first use case, maybe if you have an example off the top of your head, or can speak about what would be one or two easy use cases, super low risk, that you've seen deployed or that you would tackle as a first use case for deploying responsible AI, and any best practices around that, maybe why that you choose that use case over a different one.
As a former provider network kind of leader, I'm definitely going to be leaning more on the network side of that Payvider or payer organization. So especially with COVID too, the provider experience has kind of gone under the radar, and unfortunately has devolved a little bit into a place that is almost forgotten, right, by payer organizations, and kind of rebuilding those relationships up from effectively from the ground up. So I think like a use case that'd be really beneficial is kind of like augmenting that provider experience within a payer network and giving that provider, kind of the ability to inbound, ask those questions about claims, why is it being readjusted for the 100th time, et cetera, and really start to guide them through the process. Like at Salesforce, we talk about like the pizza tracker of tracking. Well, it's very similar from a provider experience perspective on claims. I think 80%, 85% of all inbound from provider or like provider organizations into kind of a payer related to claims, right? Like, when's this claim getting paid? Why is it being paid this amount? Why are you readjusting it? Why have I not received funds yet, et cetera? So being able to have a better experience there starts to open up the footprint for other strategies within a payer organization with how do you actually make that provider relationship better, right? And so this is kind of that really low hanging fruit, really easy layup to kind of get a win on the board for a payer organization to start thinking about better ways to service up those provider relations by giving a more seamless conversational surface or canvas to actually deploy that provider, kind of feedback loop into the organization.
Yeah, and I think I'm going to lean a little different, but again, based on some past experience that I've had running clinical call centers where we're doing outbound population health type work, right, trying to move star measures. I think there's a big opportunity on conversational assisting your conversational assistants to assist your maybe clinical call center staff on how to better explain and teach members about their benefits. Like some of the different explanation of benefits, right? I mean, if you've ever tried to read an explanation of benefits, like that is confusing. And I'm a pharmacist and I've worked in the payer space for 15 years and I'm still confused sometimes when I read it, right? And understanding. And kind of similar to what Kyle was talking about on the provider side, but also helping educate the members and helping meet them where they are, right? If you know about a member that they have a certain reading level and a certain level of understanding, right? Teeing up some educational materials on like, here's the best way to explain this to Kyle versus explain it to John, right? I think there's really cool use cases there, and it really just helps your agents build better relationships in that. And again, you have all the data there, you have your knowledge base, you have all the benefits materials, and you're leveraging the power of conversational AI to actually distill it down and simplify it for your members.
I love those examples. Maybe just add a tip here. Start with the skills, the jobs to be done, the automations that are kind of you need to understand what the user is saying really well, but then you don't need to go and generate and reinvent and calculate. A great example is find a provider within the network that accepts the insurance. And then understanding what you're looking for, where you are, asking the right questions to make sure that I understand what you're looking for, and then making the recommendation from a data set that you trust 100%, and there's no generation. Another example is renewing my membership card. Understanding that you've lost it is very easy for AI to do today, and triggering the right process, that's really low-hanging fruit.
Awesome. In the last 2 minutes we have, maybe just 30 seconds each, if you're all looking into your crystal ball, a year from now, 3 years from now, where's AI going to have the biggest impact?
Should I go first?
I can go ahead and look at my crystal ball. Well, I think if I look a year from now, I think right now is the time where these use cases, these starting use cases are taking off. And I think it's just going to be a continual, like we're in the crawl phase right now. And I think we're going to be walking in a year, and then the run is maybe a year out. But I think what Uri said, the trust piece is where I think our healthcare organizations are going to build that trust. We've seen a lot of really cool use cases around conversational AI, really leveraging and superpowering our agents. And I think if I look into my crystal ball, my ultimate goal is I want call handle time to go up because our conversational assistants are so good at taking the really low hanging fruit, the calls that take 5 or 10 minutes, right? I want our average calls at a payer to maybe be 10 or 15 minutes, right? Because all the easy calls are gone, and we're taking times with our sickest patients, making a difference for them. So that's my crystal ball. Ultimate goal is call handle time going up in a year.
Love it.
Yeah, and that's mine too. Trust. Organizations will understand like how to use AI foundationally, and it's not going to be this amorphous, nebulous thing. They will be able to see beyond use cases and look at incremental strategy. Yuri, to your point, like what are those like behavioral or use case elements that you're able to enhance existing jobs to be done? They will understand it, and healthcare organizations will start to innovate within AI instead of being a laggard, which is, I think, the main benefit here.
I love it. So I'm going to go one step further, I think, into the future and say once we've established trust in specific use cases, I think what's going to happen is companies are going to recognize that these assistants, these agents are kind of becoming their brand. And they're going to invest a lot in getting these assistants to make you feel like you're speaking with this specific system. And not just in terms of the tone of voice, but in terms of what it can do. And I think going a bit, so they're going to invest a lot in what it's allowed to do and how it behaves and how it reacts. And going a little bit more into the future is I think it's going to be much more of a helper to, even offline. So with reasoning and with understanding what you need. Maybe it's not an online interaction that you're calling and you're waiting. Maybe it's something that I know you need. I'm taking care of it. Once it's ready, I'm going to alert you. I think it becomes much more asynchronous where kind of the agent is working for you behind the scenes. And maybe it's not interacting directly with you. Maybe it's interacting with your, Siri, which is your personal assistant, becomes your personal assistant. And that talks to the, the business assistant or agent. And I think that is really where exciting things are going to happen. But we need to wait a little bit to build the trust first.
Kevin, Kyle, Ori, thank you all so much for being part of this panel. We're out of time. I'd love to keep the conversation going. Thank you so much for joining. To the audience, thank you so much for listening in. And we'll hope to see everyone on the next session.
Thank you so much.
Thanks, everyone.
Bye.
Thanks, everyone. Take care.